1650 to schedule an appointment today.
Okay. All right, guys. Welcome back to Dr. Gilead's show. We're talking about factitious disorders today, and we're talking about factitious disorders, and we are on Facebook Live and on WBGR Radio. So you can call on 301-429-9247, 301-429-9247, Dr. Gilead Show, and on WBGR Radio and FaceTime. So we're talking about factitious disorders. So what are the symptoms of factitious disorders? Now, an example is people who you have them changing symptoms, and the symptoms are not clear. So the symptoms go from one thing to another. And the symptoms are inconsistent with medical history. Inconsistent with medical history. Now, sometimes they come to the doctor, they give textbook symptoms of the illness, and you will know that they have rehearsed the symptoms. They've studied it from the books, they've read it, and they're giving you what we call textbook symptoms. Now, sometimes they use too much medical terminology. They talk about the illness so much. The terms they use, you will know that they've studied this illness from a textbook. Other times, you have them surrendering themselves to every possible medical test or procedures without caring or asking for the complications. So someone who has an illness, one would expect that they would ask questions and say, and the doctor says, I'm going to do this test. I'm going to do this test on you. I will do this, and then one will ask, what is this test for? What are the problems that I could have from this? These people don't ask. They just want to go through the test so they can prove to themselves that they have this illness. That is a problem with the illness. People who have factitious disorder. Now, another symptom they have is they do what we call doctor shopping. They go from one doctor to another. Doctor shopping. And sometimes when they come to the doctor, they have multiple surgical scars. You go to a doctor, and the doctor is examining. You see multiple scars on the abdomen. That shows that that person has gone through a lot of surgeries. Sometimes you want to ask, what are these surgeries for? They hold back information. Sometimes when you ask a doctor, you want to get what we call collateral information, and that means you need to talk to another doctor or the previous doctors to find out what happened, what were you treating this person for, what were the symptoms at that time. And every patient or any patient will give consent to their doctor to talk to the previous doctors, but people with factitious disorder will not. You push and push, they say, no, I don't want you to talk to that doctor. And they can give you multiple excuses why you should not talk to the doctor. Oh, that doctor did not like me. That doctor I didn't like the way he treated me. That doctor did not have good bedside manners and all that. Then that's when the doctor becomes suspicious that, whoa, something is not right here. Why would this patient not want me to talk to the previous doctor? That is very common. And sometimes they don't want you to talk to family members. If a patient comes to me and I think that their symptoms are not adding up, I always ask, can I talk to anyone in your family? Can I talk to your husband, or can I talk to your wife? Once they say, oh no, I don't want you to talk to him, or I don't want you to talk to her because they this or they that, then the doctor gets suspicious. Why doesn't this person want me to talk to the to the family members, because family members are always a good support. They are always a good source of information. But a person with factitious disorder will not want you to talk to the doctors or to the family members, because they know that the family member is going to tell you that, whoa, this my brother or my husband or wife or my son is doing this, is going from one doctor to another. They don't want to let you talk to that family member who can give you the information that may help you tease out the diagnosis of factitious disorder. Now, because of the problems that people with factitious disorder could have, there are a lot of complications that could happen. Now, number one is the patient can die from constant procedures because they're going from one doctor to another. And we live in a litigious society where something happens, the doctor could get sued. So what happens, once a patient comes and they are complaining of a problem, you must do a thorough investigation. You must do a thorough workup. Check anything that could be the problem. You may get x-rays, you may get blood work, urinalysis, take stool, get CT scan or MRI as the case may be. And of course do physical examination or what we call mental status exam. Get a good history and get collaterals from family members. Now, because people with factitious disorder are exposed to all types of procedures, all types of laboratory investigations, what happens is they get exposed to radiations, x-rays. So they go to one doctor, they present with a chest pain, for example, or cough, or difficulty breathing. The doctor sends them to x-ray. So they get an x-ray from Dr. A today. Tomorrow they get an x-ray from Dr. B. So every other week, because they're going from one doctor to another, and there is no coordinated care, because they will not let you talk to the previous doctor, what happens is every new doctor sends them for an x-ray, for example. So the amount of radiations they get exposed to could be high. And at the end of the day, they may have such amount of radiations that could predispose them to cancers or all manner of problems. That's number one. Now also, because they want to always be seen or diagnosed as ill, they do all manner of things. They could cut themselves. They could put little cuts on themselves to contaminate their urine. Sometimes they could cause fractures. Sometimes they could cause sprains. So they gradually destroy their bodies to assume the sick role, to make people know that really they are sick. And that becomes a problem. That becomes a real problem. So that is one of the ways that they could have complications from this illness. Now, also, they can sustain a permanent injury. In course of trying to assume the sick role, what happens? They could destroy their bodies. Number three, they get unnecessary treatments, unnecessary medications that really they don't need. We know that every single medication has a side effect. Can you imagine someone goes from one doctor to another and he gets or she gets a pain medication all the time? And of course, in their head, they believe that they are sick. They take the medication. Even simple Tylenol every day can destroy your liver. So they get side effects from these medications, and that could be a long-term problem. Of course, it becomes a vicious cycle. They take a medication that causes problems. They end up in the hospital. They get surgeries, or they get admitted into the unit, into ICUs, and that really propagates their illness and their thinking. So, and that is what makes them feel better. So they continue to be sick. That is factitious disorder. Now, also, they may go through multiple surgeries. Once you cut an abdomen open, there is a healing process. It heals with what we call adhesions. Adhesions are adhesion bands. These are ligaments or things that form inside the abdomen that could end up causing intestinal obstructions. So the multiple surgeries end up causing complications, and that plays into their sick role. That is how these people have they continue to be sick, and they continue to play the sick role. Now, what is the treatment for factitious disorder? The first thing, there is no treatment. For real, there is no treatment for factitious disorders. Now, the first thing is for the doctor to really find out if there is an illness or not. The doctor needs to check and go through, make sure that this person really has a problem. If it is abdominal complaints or complaints in the chest or joints or whatever complaints they have, the first thing in treating it is the doctor must find out that they really have it. Once the doctor can confirm that they have it, he can treat them. But also, because in factitious disorder, there's really nothing to find except the injuries they caused themselves, then there's no real treatment. So, but we educate doctors to make sure that they get good history and try to get collateral information. Call family. Insist on talking to the previous doctor. If there's no such an illness, you want to change the way the person uses hospital or the clinic. Encourage them to, they can come, but don't give them any more treatments. Don't tell them that they don't have the illness, because once you tell them they don't have the illness, then they go to another doctor and you lose them. Once they go to another doctor, they begin to get the same procedure again. Now, in case of factitious disorder imposed on another person, you need to save that victim. You need to save that person. You need to call, for example, if it's a minor, you need to call Child Protective Service. If it's an adult, an elderly person, you need to call Adult Protective Service. This has to be reported to save that victim, because the person who is carrying out this Munchausen syndrome by proxy needs to be reported to save that victim, to save that disabled person who cannot speak for themselves, or that elderly person who cannot speak for themselves, or the child who is who is in this situation. So they need to be treated. They need to be, the child needs to be actually taken away from this person, and the individual perpetrating this this disorder will now need to be prosecuted. It's criminal, as a matter of fact. Now, the treatment that could help, that may be able to help them, is therapy. Excuse me. The treatment that may be able to help them is therapy. But what happens is, once they acknowledge that something is not right with the way they present, with the way they think about their mental health, about this illness, and if you are able to break through to tell them that this is not real, then they can do therapy. But what happens in 95% of the time is they won't take the treatment. They will go away. They say, well, You say I don't have an illness. This is mental. They go away and they continue their doctor shopping. But if they stay, then through therapy, you can change their thinking. But what happens is most of them will not attend therapy. So the most important treatment is preventing the dangerous and unnecessary procedures. Family members will really be a great part of the treatment. So they can help, intervene, talk to whichever doctors they go to break this cycle of feeling of illness. Or else they will run from one doctor to another and they can never get better. Now, what is the effect of factitious disorder? The individual who spends all his time going from one doctor to another will not work. They'll miss work. So what happens is they don't go to work, they have no income, or they lose time, they lose income. They end up getting fired from work. Once they get fired, they don't have any income. If they don't have any family support, of course they become homeless. They lose their cars. They can't pay their car note anymore. If they have a car, they cannot fix the cars if the car breaks down. So they have no car. They can't go to work. They become homeless. Then they have a real bigger problem. So this has a very severe effect on the person, on the individual who has this illness. That is number one, on the individual. Now, another effect of factitious disorder is on the family. This individual, whether the son or the spouse or the daughter, is going from one doctor to another, going through one procedure or another, they can never have any good family relationship. So what happens? They get into conflicts with family members because they're going from hospital to hospital, from doctor to doctor. A lot of family income is spent on treatments that is not really needed. Sometimes family members will take them to the doctor, and on getting out, they create more problems. They hurt themselves, they sprain their ankle, or they create more illness that will make them go back to the doctor. And at the end, they say, oh, this doctor is not helping me. They go to another doctor. That is one of the major complications. So what happens is, to the family, they are caught up in this web of a family member who is not really ill, but creating an illness in themselves, so they can assume the sick role, so they can always appear to be sick. It throws the whole family into a chaotic situation. So at the end of the day, all family members are trapped in this web. But once the family members realize that, whoa, this is not right, there's really nothing wrong with you. But you can't tell them that. Once you intervene, if they have a doctor's visit, you go with them. That will help that individual. Now, so because of this ill person, the whole family is affected. Money is spent. Money that the family does not have is spent on this unnecessary hospitalizations, unnecessary procedures, surgeries, hospital stay. It has a lot of conflict. So what happens? Family members end up abandoning the individual. Sometimes spouses can't take it anymore. So there is breakdown in family relationship. There is breakdown in family communication. The individual who has factitious disorder will now stay away from the family, will no longer communicate with the family members. And once that happens, they're by themselves. They stay away from the other family members. That is another complication. Now, there is an effect on the society as a whole. There is lost productivity. in the family or in the society as a whole, the um, the individual is spending a lot of insurance money. They don't go to work, so the productivity is down. And they end up, because they are not productive to the society, they are in hospital all the time. What do? They don't give to the society, but what the society has, they take. So they spend a lot of insurance money on a care that is not needed. These people spend approximately 5% of the insurance money for procedures that are not necessary. But the doctors cannot be held responsible for this, because the doctor wants to make sure that their patient is properly taken care of. So the individual goes through all this process, all these procedures without any good result. So how do we help them as a society, as a family member? Because this individual cannot help himself or cannot help herself, so they need help from us. So what do? Family members should encourage them to get help and stay with one particular doctor. Family members should go with them when they have a doctor's appointment. Go there and speak on their behalf. They may not like it, but once you show love to them and you go with them to their appointments, don't go to the doctor and say, oh, they don't have an illness. This is all in his or her head. No. Once you say that, they will kick you out. They're not going to want you to be part of the people that will go with them to see their doctor anymore. But once you show that you care, go with them, see the doctors with them, and if you have opportunity, talk to the doctor by yourself. Speak to the doctor at the back. Say, hey, this is his problem, or this is her problem. She goes from one doctor to another. She thinks she's sick. Sometimes she creates this illness. And that immediately will catch the doctor's attention. So the doctor does not have to put them through the same process, the same procedure they've gone through before. As a family member, you should give them as much support as possible. Speak on their behalf. Now, if it is with a if it's someone who has if it's someone who is a minor or an elderly person, then other family members will need to intervene. And this is in the case of Munchausen's syndrome by proxy. People will have to come in and make sure that this care provider or this family member does not take this individual through unnecessary medical evaluations, tests, procedures that they don't really need, because in this family member's head, this minor or this elderly person or this disabled person is sick, and they project it that way because the individual, the victim, cannot help themselves, so they take them from one doctor to another. So other family members must report this case. Now, it is for healthcare providers to be on the lookout all the time. If you suspect that a minor is being taken from one person to another, or an illness is being imposed on this person, that is the factitious disorder that is imposed on somebody else, Munchausen's syndrome by proxy, then we must report this to law enforcement agencies. Child Protective Service must be contacted. We have to let Child Protective Service know. That way, that child is taken away and put in a safe place. If it is an elderly, please report it to Adult Protective Service. I consult with the Adult Protective Service in Prince George's County, and we've gone to homes and we've seen elderly people that are taken advantage of so much because the individual perpetrating this act is a normal person, a person who is either a family member or is a friend. And the victim, possibly a lot of the times, has been abandoned by other family members or by other friends. So this individual they trust will take advantage of them. I've been in houses where you see a lady, an elderly lady who finished paying her mortgage, her husband passed, and she brings in an individual from the church, an individual she met somewhere through a friend. That individual comes in, takes over all her care, and could victimize him or her and take them from one doctor to another just to perpetrate the sick role on this victim. And because they're caring for them, the individual trusts them. And when they go to a doctor, they say, you can't talk, I do all the talking for you. So once you come across such a person and you suspect that this individual is being victimized or an illness is being imposed on this individual, please speak up. Please report to Adult Protective Service. And they will call. We'll go to the house and we'll look at the adult, we evaluate, we make sure that they are not victims of imposed factitious disorder. It is a serious situation because they can force this person to get unnecessary surgeries, to get unnecessary procedures, unnecessary lab tests, and because they are helping this person, when they give urine, they can contaminate the urine, and the lab would only report what they see in the urine. And if the doctor or the healthcare provider does not know this, they begin to treat that victim for the illness, when, as a matter of fact, they don't have any illness. It's just someone that is imposing this illness on the individual, on the victim. And that could be a dangerous thing. So family members, siblings, and other parents, the society in general, must be on the lookout. In the inpatient units, in the surgical units, in the medical units, it's been reported that 1% of people that are admitted into the hospitals have factitious disorders. So we must be on the lookout. I'm cognizant of the fact that doctors don't want to get sued, but document your findings. And if you don't think that this person really has an illness and there is a disconnect in the symptom that they are reporting, there is a disconnect in the presentation, then you must help them out here. You must tell them that what you're having, what you're reporting does not correlate with the symptoms and the symptoms that I'm getting. When a patient presents with a symptom, you need to look at the signs that you're getting. Examine the patient, and if there's no correlation, then your antenna must be up. That way, you make sure that you are treating this person. You're not going through a cycle, doing the same tests or doing the same procedures. Some people have had multiple surgeries. They've been cut open several times because the individual keeps reporting the same thing. And you do x-rays, you do CT scans of the abdomen, you don't find anything. But because they keep complaining, people do what is called exploratory laparotomy. They explore the abdomen. They go in, people have had endoscopies done, you put a tube in the mouth and run through, and you don't find anything. But still, the individual keeps complaining of the problem. So what do? Most doctors will try and give them some help. So whichever way it is, doctors, healthcare providers, nurses, family members must be on a lot. Your antenna must be up all the time because there are these people who have factitious disorders and they create an illness on themselves. So, ladies and gentlemen, this is factitious disorder. We must all look out, we must all be on the lookout to make sure that they don't have, they really has an illness for which they are being treated. Otherwise, you can report, tell the doctors, report in cases where they are minors, report to Child Protective Service, report to Adult Protective Service for the elderly, or even the disabled, report the cases to the agency. You can also call 911. You can call the police. They will investigate it. This is factitious disorder we've talked about today on Dr. Gilead's show and also on WBGR Radio. I hope you've enjoyed it. If you have any comments, you can send it to our Facebook page, Dr. Theo, one word, Oswala MD, another word. So Dr. Theo Oswala MD, send it to our page and we can always respond, ask questions, make contributions. We are here every Thursday at 1 p.m. Eastern Standard Time. So stay tuned. I want you to log in again Thursday next week at 1 p.m. and we'll be on the same show, on Dr. Gilead's show, and Facebook Live, as well as on WBGR Radio. Thank you for tuning in today. We'll see you again next week. Thank you very much.